Hi, my name is Melise Venable, and I am the group leader for Group 10, and our group topic is over healthcare, with each member's focus diving into the boundaries faced by those seeking quality healthcare. My focus is going to be on the differential treatment men and women face when receiving treatment from healthcare professionals.
Hi, my name is Ava Anderson, and my subtopic is mental health and how men and women and those who identify as neither receive healthcare in accordance to mental health.
Okay, so my name is Pauline, and my focus is going to be on how quality healthcare is restricted for those without the necessary financial abilities, as well as how insurance has affected the medical field.
Hi, my name is Leah Gonzalez, and my focus today is going to be on discrimination and racism within the medical field.
Hi, my name is Kara White, and my focus is going to be on sexuality and gender presentation and how it affects treatments received from healthcare professionals.
We will discuss women's research in the medical field and restrictions women face in receiving contraceptives, the social pressure men and women face in receiving mental health treatment, the inaccessibility of affordable healthcare, how minorities receive worse treatment in the medical field, as well as how those in the LGBTQ+ community are treated in the medical field. We wish to inform you of the staggering inequalities inside healthcare, as well as how you may help combat these issues through petitioning and educating yourself on these issues.
To begin this podcast, here is Melise.
It is no secret that women have had a significant disadvantage in society, and healthcare is one of the factors I am incredibly sad to say is not an outlier. Men and women receive different treatment in the medical field. Women face a lack of control for voluntary childbirth and access to birth control, as well as a feeling of not being listened to by their doctors, and a lack of information regarding sexual health and wellness. There is significantly more medical testing done on men than women, even on drugs that are prescribed to both genders. Some sociological concepts may explain some of these findings, such as conflict theory, the theory that society is in a state of perpetual conflict because of competition for limited resources, and how studies over medicine take time and effort, and to cut down on cost and repeated trials, it's simpler to test on men. There is also the concept of feminism. First embraced as a social movement to advocate for women's rights to vote, it later...
Now, here is Ava.
Hi, my name is Ava, and I'm going to be talking about the subtopic of mental health. Let's start with hegemonic masculinity, which is the condition where men are dominant and privileged. This relates to mental health care because men try to conform to these ideas of hegemonic masculinity by not asking for help and support that they need. The next important idea here is the idea of informal social sanctions. These are the unwritten rules of social life one must follow in order to exist within a social group. This is an important part of mental health care when talking about sociology because we have to address the stigma around men reaching out for help, which in the past has not been a part of the informal social sanctions. Hegemonic masculinity and social sanctions both increase oppression and violence towards women, which can be detrimental to their mental health. That brings me to our third point about role strain. Role strain is the incompatibility among roles corresponding to a single social status. For example, men might feel like they have to choose between the social norms and expectation of a man and someone with mental illness. Fourthly, let's talk about resocialization, the process where social values, beliefs, norms, etc. are restructured through intense social processes. In order to destigmatize mental health care and increase access for all individuals, we must resocialize ourselves in society. Last but not least, there's intersectionality. This term, coined by Kimberly Crenshaw, can be defined as the interconnected nature of social categorization such as race, class, gender, sexuality, etc. When adapting mental health care, it's important to take an intersectional approach so that everyone feels as though their key identity factors are seen. Intersectional identities impact the way people can access mental health care. 2, as certain groups might experience historical mistrust in the medical system or be more likely to be impoverished and make it inaccessible to care or to receive gender-affirming mental health care by law. It is important not to leave out any groups out of the conversation of mental health care and gender.
Now we're going to do our interview with Michelle, and Michelle, if you could just introduce yourself a little bit.
Hi. So I'm Michelle, and I'm currently a PCT at a dialysis clinic. So I work with my patients. I put them onto their dialysis machines, and I help my nurses out with giving the treatment to our patients.
Okay, and I just have a couple questions. Have you seen a difference in how patients of a lower versus a higher financial status are treated? And they could be in terms of healthcare coverage or general accessibility.
Yes, because not necessarily how they're treated, but you can tell when patients have better healthcare coverage. They come in with nicer catheters. They come in actually with more stuff that we have to do to them. We have to give them routinely checks versus those who don't have as good of a healthcare coverage. They don't get those access checks. They don't get the doctor's visits as often. They don't have the nephrologist coming to them at the chair side. They also don't get as much medication compared to those who have better healthcare coverage. So there's always that.
Okay, thank you. And do you think that racial, gender, and sexuality discrimination are common in the medical field? And what are your experiences with dealing with discrimination?
Luckily, I don't think that's necessarily common in my clinic. I think most of us, our training kind of entails, everybody who is working there has to pull their fair share of weight. At the same time, those who, women are expected to handle less heavier work. So if we have anything, like any equipment that's necessarily really heavy, our male coworkers would be the ones to handle that type of stuff. But generally, everything else, it's fair game.
Okay, so how do healthcare centers, I guess specifically yours, handle discrimination? Is there like a specific person at your place of work that handles reports of discrimination?
Yeah, that would actually be either our social worker or our faculty, our FA, our faculty admin. And those two are going to be the primary people you go to if you have any reports of discrimination. Our social worker would kind of address the problem, and then our FA would be the one to handle the report and to basically write any notes about the incident. But yeah, the two of them work together in any cases like that. Any sorts of complaints, any sorts of harassment, any sorts of discrimination, fights, anything like that will go through the two of them.
Okay, and I wanted to ask specifically about racial stereotypes as well. So what negative racial stereotypes have you seen within the medical field?
Luckily, our clinic patients are like 80%, I want to say 90% all Hispanic, so there's not a lot of problem in that area. But I do know that, the racial stereotype of maybe them not having better access to healthcare is true, especially when it comes to like us being located in East LA. There are people who do struggle to get that healthcare. There are people who have made jokes like, oh, you guys have like a really terrible clinic because obviously you're located in a really terrible area. But that's not true. Our staffing is fine. All of our equipment is new, so that's not really as trippy as people say. Yeah, that's it.
Okay, and I guess that's all the questions I have for you today. Thank you so much for answering a couple questions for our podcast.
No problem.
Hello, my name is Kara White, and today I will be talking about how LGBTQ+ people are often discriminated against in healthcare. To quote data from the 2019 Behavioral Risk Factor Surveillance System, the BRFSS, 3 in 5 transgender respondents report experiencing poor mental health at least one day in the past month, a rate 23 percentage points higher than that of cisgender respondents. 54% report poor physical health at least once a day in the past month, a rate 18 percentage points higher than that of cisgender respondents. Transgender populations also face an increased likelihood of developing cardiovascular disease, as well as a higher likelihood of having asthma, and their rates of chronic depression are more than twice that of cisgender populations. Transgender respondents are significantly more likely to be living with HIV. This data is not surprising, but it does demonstrate the disparities between healthcare that LGBTQ+ people obtain versus those who obtain healthcare that are cisgender and straight. We hope that you have enjoyed our podcast and that you were able to take away insight into barriers that marginalized groups face while accessing healthcare. This podcast is an assignment for sociology class Introductory Sociology at San Diego State University. The purpose of the assignment is to help inform us on key issues related to sociology of the body. The positions being advocated may not necessarily reflect the opinions of the students developing this podcast. Thank you.